Recent media response to Korea's COVID-19 strategy has been mixed, with some claiming the country may be among the first to usher in an endemic phase of COVID-19, that is, and others insisting challenges remain as caseloads have yet to subside. For more, I have freelance journalist Jack Barton here in the studio. It's a pleasure, Jack.
Pleasure to be here.
I also have Nicolas Rocca at Radio France Internationale.
Thanks
Nicolas,
for the
welcome.
invitation.
Right. Jack, we'll start with you then. So you've been covering the pandemic here and elsewhere for quite a while now. Before we start on that, though, out of a score of 10, what would you give Korea's COVID-19 strategy and why?
Well, we have to remember that it isn't over yet, and we're seeing different mutations. We're all hoping they're weaker mutations, but of course a stronger one could crop up. So we really need to wait another 5 or perhaps 10 years before we can give a good score. I'd say if South Korea, if it had only happened, if it was an epidemic that had only happened in South Korea, the handling would still be considered very good. There's no such thing as a perfect strategy or a perfect response, but I'd have to say it was an 8. But having traveled around and seen the way that other countries dealt with it, and then you look at the way Korea very quickly moved to, on the same day as receiving the genetic material from China, to start coming up with testing systems, churning out respirators at car factories, immediately coming up with strategies for intensive care units, improvised testing facilities, drive-through, mobile phone testing facilities, of course, track and tracing, all of this. Phenomenal. If you compare it to other countries, I'd have to say a 10 plus, a slightly higher than perfect score.
Right, thank you for your kind words then. Nicolas, how does Korea's present strategy then compare with its past?
I think we've seen a shift around February when President Moon Jae-in mentioned that we're changing and adapting to Omicron. So before there was a stress on limiting the number of cases as a whole, and then we shifted into a strategy that was focusing on limiting the deaths and the severe cases. So that meant the end of contact tracing as we have seen, and a shift to only focusing on hospital capacities, ICU beds being enough to welcome a patient. And I must say that shift has been pretty much efficient. There has been a few maybe hiccups. It took a bit of time in order to shift, which is perfectly understandable. I remember I had COVID at this moment, and the health workers didn't really know what rules they should give me, but then we have seen it has been pretty efficient, and I think the fatality rate speaks for itself. South Korea is at 0.13%. It is very low compared to almost every other country in the world.
Right. There was quite a bit of talk, though, about our tracing efforts in the initial stages of our fight against the pandemic with regard to concerns over privacy. What are your thoughts on that?
Well, I actually worked a lot on that because it's true there's been a bit of a fascination in Europe, at least, on the private data of people being given to the government. And so I was able to follow contact tracers from Sochogu. And I was quite surprised to see it was, some almost police investigation work also that was done, really going to the location themselves. And I think when there was some explanation that was made about how it really worked, people that listened to or read the stories I've done, the feedbacks I had is that they were mostly surprised and that they felt the privacy was more respected than they actually believed.
Right. Jack, a number of foreign media outlets now say that Korea may serve as a model for learning to live with COVID-19. Do you agree?
I think so, but most of the focus has been on how to get to that point. The media focus has been on how do you get to the point where you can live with COVID-19. So getting those vaccination rates really high, making sure all the facilities are there, that the hospitals aren't overloaded with people, and creating a stable condition. And I think that is there, and those few articles are right. What I would say is the great shame is that not enough countries have looked at South Korea's model and taken it on board. And throughout the pandemic, each country has tried to reinvent the wheel for itself without looking at other countries, particularly to East Asia and particularly to South Korea, for lessons learned. And if they do look elsewhere, it tends to be at countries that are doing worse than they are, so they can convince people, look, we're not doing too bad because look at this place, and not spending enough time looking at the systems that really worked. And I think that's one of the great shames. I think it's a lesson that still hasn't been learned. And, there isn't enough preparation out there in case this happens again.
And staying with the optimistic outlook then, Nicolas, what factors perhaps look to facilitate Korea's early transition, that is, hopefully, into an endemic phase of COVID-19?
Well, I first think that Korea was more ready, perhaps, than other countries to receive the initial waves of COVID-19, maybe because of the precedent of MERS. But the system was already in place. We had KCDC that was able to do, answers efficiently and quickly. I think also the efforts of the Korean population have to be stressed, even though there was a feeling of tiredness that we could feel when we talked to people. Korean people still seem to respect the basic rules, wearing the mask. We know it's maybe one of the most efficient way to actually fight against the pandemic. And I think this is also partly because the Korean government has tried to continue to communicate throughout the pandemic to keep the people still focused. Of course, you mentioned also the high vaccination rate. That is definitely a key factor if you want to change to an endemic state of the pandemic.
Right, of course. Meanwhile, Jack, some say Korea's lifting of pandemic-related restrictions comes at an unlikely time, as caseloads currently still remain quite high. In fact, they believe that the ease in these measures may be more related to politics than health. What are your thoughts?
Well, that is something we've seen all around the world. Over the past 12 months, whenever a country is going into an election, we see restrictions being eased. And that's something we're seeing everywhere. So there's no doubt that there is a political element to it. But as you just mentioned, caseloads down to 0.13%. That's sort of around in line with a strong seasonal flu. So it raises the question, if not now, when? There's no doubt a political element to it, but it's probably in line with the direction that everything should be going at the moment anyway, given that it has, from any way you look at it, entered an endemic phase. Again, we might get a stronger strain. It's not over yet. There could be surprises ahead. But as the situation currently stands, it would make sense, I would argue, the direction that politicians are going, even though, absolutely, there's no doubt that the recent election and the upcoming change in government is playing into what's happening.
Right, and on the same wavelength, Nicolas, there are some health experts who claim that economic concerns are being placed ahead of epidemiological risks. What are your thoughts on that?
Well, if you compare it to European countries, I think that in Korea we cannot say this because, we have kept some restriction that still put economic barriers for, small store owners, coffee owners, small business owners as a whole. I think there has been a lot of pressure on them. And I think we just cannot say this. In a way, what maybe is hard to do is to try to balance it. And that's what I think the Korean government tried to do, to balance the economic life that is necessary and the epidemiological risk. So I would not agree that the Korean government has done it only for economic concerns.
Right. Nicolas, are there any aspects of Korea's COVID-19 strategy, perhaps that may have been enhanced, that is, to allow for a better response mechanism?
In retrospect, there are probably always some systems that could have been enhanced, but that's beyond the incredible level that they were already at. So if we look at track and trace treatment, if we look at the hospital response, if we look at all of it, these were immense. It went far beyond what most countries did. And then if we look at some of the earlier steps where we thought at the time, well, maybe that's the wrong step, like not closing arrivals from China. And a lot of people thought maybe the government got that right, but it turned out that it really didn't make much of a difference. Countries that did close those routes, well, it just came in via somewhere else. And so Moon followed World Health Organization recommendations, which was to not block arrivals from countries, and until late last year also followed WHO rules on mandates. The WHO saying there's no evidence they really work because, of course, even though we know that the harm done to people is reduced by vaccines, transmission doesn't seem to be greatly affected. So perhaps that was a government misstep, complicating matters for small business further when it had already been shown that that probably wasn't a great idea. But overall, I would really argue that the government went above and beyond what so many other governments did. And I don't want to sound like, a massive fan of the Moon government. Sure, I've got plenty of criticism for other policies like the real estate policy, which probably lost the government the election. But on this one, I really think the government got it right. And one of the ways they got it right was just once they decided to act, going all out. I mean, putting every effort into it, particularly when it came to cooperation between government ministries and the health department. That's also something we really didn't see elsewhere. Was that incredible effort of coordination between the various departments, without which I don't think they could have achieved the success that they did.
I see. And staying with that, Jack, are there any other aspects of then perhaps a Korea's strategy that could be led by other countries?
One is just to be prepared. You mentioned the MERS earlier, the fact that South Korea did get that so wrong and learned from those lessons back in 2015, I think it was, setting up roughly 150 laboratories across the country that were ready. If something popped up, you know, they could basically work on what they had, and those laboratories could just set to task immediately. The fact that they had a kind of a medical response emergency plan in place, the fact that the big car manufacturers could retool up so quickly to start pumping out respirators. Just this pre-preparation, having a plan and following through. And the other one, and this is a little bit controversial, I would say, not abdicating political responsibility. So many other governments around the world just step back and essentially let health officials take over the running of the country, including the economy and everything else. And the South Korean government didn't do that. It came under enormous pressure at home, again, to stop arrivals from China. And Moon said, you know, this isn't in line with basic rights, it's not what the WHO is saying, and pushed ahead. So I think, you know, that's it, having a big plan in place and not absolving yourself of responsibility in as a crisis and just pushing the responsibility over to somebody else. You know, they kept that leadership role, and I think that was really critical to the calm manner in which we're seeing with Zelensky in Ukraine. Good leadership, there's just no substitute for it.
Right. Well, they do say that prevention is better than cure, so preparation is really important then. Nicholas, like Jack mentioned, unlike a number of its counterparts, Korea was able to avoid a complete lockdown to contain COVID-19, that is. Do you suppose this reality in itself is perhaps a clear proof of both the government's and the public's active campaign against COVID-19?
Well, it's undeniably a success, because if you compare to other models, in a way, you had either Europe or the US that had some lockdowns at some point, but still had the tremendous number of deaths, and now have maybe a bit more relieved economic life and is going towards with like almost no restriction. On the other hand, what are the other options? I mean, you have China, and even though the number of deaths is pretty low, the situation we're seeing in Shanghai is not unviable either. So I think South Korea arrived to kind of a balanced answer and managed to keep the numbers of cases low until a moment it was ready to have a higher number of caseloads and just adapt in order to prevent its people from dying. That being said, I think if you mention that Korea has been a success, it has definitely been, and foreign medias have been underlying it, I think there has still been a few problems, and there has been a few things that were not really well perceived, I think, for medias, international medias. And there has been two moments maybe that I keep in mind, and it's the mass testing of foreign workers in Gyeonggi province that did maybe not a lot of sense scientifically speaking, and that maybe hurt a bit the international image of Korea that was definitely defined as a model. And on the other hand, also the fact that the vaccine recognition were not allowed to, for foreigners vaccinated abroad for a while. And I mean, those little two, it appears as maybe symbolic or not very important, but I think it hurt a bit the image of South Korea that was throughout the pandemic almost always considered as a model.
And staying with that, Nicholas, do you believe the actions that came after those unfortunate events served to perhaps ease the impact on Korea's image?
Well, I think it definitely did, but the problem is that it came only after there was a lot of publication of different medias. I mean, it appeared a bit like a reaction, and I think there has been an understanding afterwards from the Korean government that those measures were not really scientifically useful, and were just, I mean, it's hard to understand why they occurred in the first place, because they had no scientific value, and it hurted the image. But I think maybe, perhaps the good thing is that the Korean government understood that on the international scene, they really benefited from their, we're just saying, the very efficient way they handle COVID. I mean, in a way, it didn't make sense to hurt this global image with those little mistakes. Probably it's been understood by the current administration.
Right. And staying with that, Jack, some local commentary regarding the government strategy claim authorities are rushing into efforts to usher in an endemic phase given our pali-pali culture. I'm sure you'll understand that. What are your thoughts?
Well, I think South Korea was very pali-pali when it came to the right things. So, you know, rushing into the response. But on some things, it's been quite slow. It's had a bit of a chonchoni response. Vaccines, but for the right reasons. They wanted to look around and said this, you know, we want to look around and make sure they're safe, see which are the best ones, and then procure the ones that we feel are the most suitable. And I think that was a good policy because they had the breathing space to do it. The tracing was keeping the numbers very low at the time. Proved to be a successful policy. And I think now they're going quite slowly. I mean, I've traveled to a lot of places over the last 6 months. I remember late last year seeing in Indianapolis in a packed blues bar with the band playing, no masks on, drinks, and thinking, was there ever a pandemic? Even in Australia, which went through an almost North Korean-like lockdown when I was there at the start of the year, again, walking around, no masks, everything was almost back to normal again. So South Korea has actually probably been a little bit slow in returning to living with COVID compared to most other countries. And perhaps that's not such a bad thing, you know, moving a little bit. It's been cautious, fast in the right areas, cautious in the right areas as well.
Right. And Nicolas, what do you suppose are some lessons perhaps that other countries, including France maybe, that could learn from Korea with regard to COVID-19 containment?
Well, there's a couple of them. And first of all, I mean, Jack mentioned the fact that maybe some Western countries had to be more humble and watch what other countries have been doing right, which, if I take the example of France, didn't. I think maybe one big lesson that hasn't been stressed enough is that communication is key if you want to keep the population on board. And since the beginning of the pandemic, there has been constant communication, twice a day press conference by KCDC, by the current government. I have covered a bit for my part the beginning of the pandemic in France. And I mean, noticing the difference between the two has been it's a radical difference. I mean, in France, we struggled to have answers from the government. We have had a spokesperson of the government saying that masks were useless. I mean, it's the opposite of what we've seen in Korea, and I think that helped to keep the population on board for 2 years. Other than that, I think the fact that Korea continued with testing throughout the pandemic. I mean, some countries maybe eased the testing once we were with the Omicron variant and the numbers were so high and the caseload were so high. Korea continued, and that allowed the country to be able to detect which cases were severe or not and keep this death rate so low. So I think this would be 2 lessons, and also, of course, being prepared, as Jack also mentioned before.
Right. And Jack, Korea is hoping to emerge as a vaccine hub in the near future. It has a plan for that, but India has been known to be making vaccines for quite a long time now. What are Korea's prospects of emerging as a vaccine hub here in this particular region?
Well, I think Korea's prospects are very, very good. We've seen whenever Korea sets its mind to something, it tends to throw a lot of government support behind it. There's a lot of coordinated effort. And one of the good things about Korea is the fact that you have very large companies. That's also a bad thing because they often suppress small to medium companies that struggle, leading to a 2-track economy. But if you could say there's a positive side to that 2-track economy, it is when it comes to something that comes to a big export potential product with big companies getting on board, it will happen. I'm sure India will also succeed in this area as well because India just has such a strong track record in this area. But yeah, look, given South Korea's capabilities, particularly in this area in bioscience and, you know, more than 30% of GDP is export driven. That's one of the biggest in the world, if not the biggest in the world, probably just behind Germany. No doubt, I think this is going to succeed.
Right. And Nicolas, you mentioned the hardships faced by some of our small and mid-sized firms amid the social restrictions imposed by the government to contain COVID-19. Do you suppose the efforts being made right now to address those problems with regard to livelihoods are working?
I think small business owners are maybe a bit relieved to see that there has been an understanding of the government. I mean, we've seen media reports and that the government was trying to discuss with them to find other options. I mean, that being said, it might take some time for them to recover from those 2 years of pandemic, even though the government tried to do relief plans, loans at lower rates. I mean, we've seen a number of shops closing. So I think the government definitely understood that, I mean, the stress was put on them, but it was, in a way, a political choice to put it on small business owners. And even though they acknowledged it, I think there will still be a lot of efforts that have to be made by the next administration in order to maybe make all those small stores owner to put them in a better economic situation.
And for the sake of comparison, Nicolas, what can you tell us about the impact, such economic impacts on businesses over in France amid the lockdown or the social restrictions?
I mean, there has been, it was different because, you know, we had 3 months lockdowns, for instance, or 2 months and a half, with no activities for anybody, but the government continued to pay salaries to people. I mean, it was a bit different because it was not relief plans with a one-time check. It was a monthly wage that was still given, which cost the government a tremendous amount of money, of course. But that still managed to keep those restaurant owners or coffee owners into a position that they could open. There's also structural differences between the two countries. It's less important in France, those small business owners. We have, I mean, it's less important if you look at the overall economy. So yeah, I think that was two different answers. It's hard to tell which one is the best. I think we're going to see this in the long term.
Right. Now, Jack, you mentioned a potential decade-long life with COVID-19. It might be for 5 years or 10 years, like you said at the start. Keeping that in mind, we have vaccinations for children approved, those aged 5 to 11. But some people claim that the government perhaps is not doing enough to encourage the vaccine uptake among the children here in the country. What are your thoughts?
Yeah, this is such a thorny issue, and whatever opinion you have on it, it's sort of dangerous. Someone's going to come at you. What we saw is with the previous strains that were stronger for adults actually seemed to be much milder for children, and now Omicron actually is having an impact on children. But we're still seeing vaccines that wear off very quickly, that still need booster shots quite regularly, and as the variants change, so does the impact. And then you've got another argument coming out now, also, you know, from a sizable level of the medical community, saying if we keep changing the vaccines to suit, you know, now that we have a weak strain, maybe we should let it run for a little bit. Now, I'm not saying that's the case. I'm not a health official, just looking at what's being reported and what people are talking about. I think this is an area that we really can't judge for a few years to come, and the debate is still ongoing about even whether adults should be receiving extra boosters of a vaccine that actually isn't suitable for Omicron or the new variants that are emerging. What's that doing to create further mutations? And I honestly normally have an opinion on most things, but I'm almost too scared to wade in on this one because it is such a thorny, contentious issue at the moment. But I would definitely say that's not a given, that children should be getting vaccinations that are from older strains, and I think that debate's still ongoing. Right,
actually, and health expert actually did say that there are more questions than answers with regard to vaccinations at this particular point. All right, Jack, thank you very much for your insights today, and Nicolas, thank you very much for your time and your thoughts.